give you a case, and you can help me figure out this case. We got to solve it, right? We have a 35-year-old male. Usually, he has unkept looking at physically. He's dressed usually colorfully, when he dressed. He live in the basement of his mother's house. So that's where he lives. He's still living with his mother. He's 35-year-old. He has few friends. So few friends. But 24 hours ago, he decided to go out with some of his old college friends, old college friends. They went out Friday night and party all night. At the party, they served some drinks. He said he doesn't drink, but that's what he said. But they served a bunch of drinks. He had fun with his friends, and finally he went home. 23 hours later, he's in the emergency room. He's in the emergency room with what? Certain signs and symptoms. And so that's where you have to pay attention to why all of a sudden he's in the emergency room. What is going on with this patient? So you have to figure out to see if you can know what is going on. In the emergency room, he's confused. He doesn't know his name, the day. So it's 80 times 1, basically. Does that ring a bell? I check his heart rate is like 125. His respiratory rate is like 30. So he went out, had a party, they served some drinks. 23 hours later, he's presenting like that. He has unkept hair, very long hair. He doesn't take a shower the way he's supposed to. And he lives in the basement of his mother's house. He has few friends. Does that give you a clue? When the nurse examining him, he's sweating profusely. So sweating, and so he's diaphoretic. And when they measure the temperature, it's like 103. Does that give you a clue? They listen to the bowel sounds. He has hyperactive bowel sounds. He's hyperactive. But he has no nausea, no vomit, and no diarrhea. That's his problem. I'm trying to let you think. This is the way this case was presented based on recommendation. So this is the way. Very confusing. You don't know where they're going to. They're trying to trap you, right? His reflexes, normal. Normal reflexes. His lungs were clear bilaterally. His heart, he has no murmur, basically. But his heart rate is high. So I would say S1, S2, normal. He has no clonus. Does that give you a clue? These are signs and symptoms you should pay attention. And no hallucination. So there's a bunch of symptoms. The nurse was like, they're going through, they're thinking, they say, what is going on with this patient? You know, they can't figure out what exactly is going on with that patient. But he came in with those problems. And so they have to figure out what is going on. But the nurse and the doctor is trying to figure out what is going on. 35-year-old, unkept head, colorful living in the basement, few friends. He went out with his college friends. They went to a party, they served some drinks. 23 hours later, he's in the emergency room with that confusion, tachycardia, tachypnea, diaphoretic, sweaty, temperature 103, hyperactive bowel syndrome. He has no nausea, no vomit. Okay. So what do you think is going on? You have to figure out. So he has no nausea. This is nausea. So they ordered some labs. They said, let's figure out what is going on with this patient. TSH is normal. His white count is 15,000. Okay. When they check his iron, he has iron deficiency, anemia. So his iron was low. And they check his creatinine kinase. Okay. It's about 10,000. So this is elevated. Does that give you a clue? Does that give you a clue? Creatinine kinase is that really, really high. The nurse also observed that, hey, this symptoms, coelochoria, right? That means he's salivating too much. These are another symptoms that they also saw. They said, oh, what is going on here? We have confusion, tachycardia, sweaty, diaphoretic, and what? Temperature that high, hyperactive bowel sounds, reflexes are normal, no cluness. And then when they check the blood pressure, he has blood pressure is like it's basically hypertensive. Then sometimes it become hypotensive, but most of the time it's hypertensive. Because of that, the nurse said, hey, I need to do something. She measured the temperature again. It was like 104. He said, I need to do something. So the nurse intervention, based on the lab work they get and everything, he said, hey, something bad is happening. So something bad is happening. So you put the patient on the left lateral DQ. Put him on the left lateral DQ. All bed rails up and padded. Okay. Bed in the lowest position as much as possible. Remove all his clothes, all restrictive clothes removed. And had the oxygen at the bedside and suction at bedside. And he placed pillow under his head. You see what I'm trying to do? I hope you got it. This is a board favorite question right there. So that's what I think. So this is what she did. Does that give you a clue what is going on? You figure out what this is happening to the patient? Yeah, I'm hiding everything for you. I'm hiding them. I don't want you to know the answer. But this is what your board will do to you. What do you think is going on? And what do we need to figure out? We have a creatinine kinase that high. And so they get a BMP, and they saw that creatinine is like 2.5. And the K is like going up. It's like 5. So what do you think the doctor is going to order based on the creatinine kinase and the creatinine of that? We have somebody is in rhabdomyolysis. This is what we call rhabdomyolysis. We CK that high, we get in renal failure. This is a prioritization patient. You have to see that patient. He's in rhabdomyolysis. Why is he in rhabdomyolysis with creatinine kinase of 10,000, creatinine of 2.5, and potassium of that? So we institute IV fluid resuscitation, large amount of IV fluid to flush the system as much as possible to empty this patient, and then try to correct its potassium. You know how to correct the potassium, right? And protect the K, and protects the cardiac function by giving calcium glucolinate first. And the rest try to lower the potassium by giving albuterol. And so you get albuterol, you get insulin, and glucose to help with the potassium. But you still have to figure out some of the symptoms that is going on. You see what is going on with this patient. So the nurse was smart enough. What did she do? Went back to the basics, critical thinking, went back to the basics, indeed, and made reconciliation. And what did she find? What did she find? Patient is on Thorazine. Does that ring the bell? Patient was on Thorazine. Does that ring a bell? Does that give you a clue? As soon as they saw that, this was their therapy. We started to cool the patient down. Cooling blanket. Patient taken to the ICU to help with the problem. What do you think is going on? 35-year-old, unkept air, colorful living, in the basement of the mother, few friends, went out with his friend. They had some alcohol. We don't know if he drink alcohol or not. He said he may have had some alcohol, but 23 hours later, he's in emergency room. He's confused. He has tachycardia, tachypnea, diaphoresis, temperature 104, bowel signs hyperactive. He has no nausea, no vomit, no diarrhea. His reflexes are normal, no clearness. He has no hallucination. With his lab work, TSH is normal, white count is 15, iron is low, creatinine kinase is elevated, consistent with rhabdomyolysis. He's salivating, hypertensive. Next, put the patient on what? Seizure precaution because of the fever. Left lateral DQ, all the beds are railed and padded in the lowest position. All restricted clothing removed. Oxygen at the bedside, suction the patient. Pillow under the bed. We saw that he is in rhabdomyolysis. We corrected the K, right? IV fluid resuscitation, correct the potassium, calcium gluconate to stabilize the heart, albuterol and insulin to lower it. What do you think is going on? Med reconciliation saw that the patient is on Thorazine. What do you think? As soon as they saw that patient is being cool, is in the ICU, and immediately we give the patient Diazepam. Immediately, we gave the patient diazepam to figure out, to help cool everything down. This is the way they presented the case. Classic, classic, classic presentation in a weird form that he has everything for you to think critically. There was a distracted there, and everybody get distracted. Easy to think it's an alcohol withdrawal. It cannot be alcohol withdrawal. There is no hallucination. Number one, if it's alcohol withdrawal, this guy will be hallucinating. If it's alcohol withdrawal, it will not have CK, creatinine kinase elevated. It does not cause what? Um, Rhabdomyolysis. Why was he in rhabdomyolysis? I refuse to give it to you from the beginning because I want you to think. He went in rhabdomyolysis because of what? We get because of this. That is the key. He went there because of muscle rigidity. This guy went into rhabdo because of muscle rigidity. This is his problem. And that's why we have CK, creatinine kinase that elevated, and potassium for us to control. And that's why his creatinine is going up. Does that ring a bell? By now, you figure it out. You're going to see a white count. You're going to see iron level. TSH is normal. It cannot be thyroid storm. He has no clonus. He has no GI symptoms. I try to give you everything to rule out everything that you know. If I give you no clonus, no GI symptoms, no nausea, no vomit, diarrhea, that means it's not serotonin syndrome. His temperature is too high to be alcohol withdrawal. No way. Of course, we did a seizure protocol because of the high fever. But the key, Thorazine. Thorazine, what do you think? And muscle rigidity. We treated him by cooling him down, putting him in ICU, and diazepam to cool down. But we got to help with the muscle rigidity. What can you do to help with the muscle rigidity? That is what they're going to ask you in the select or apply or in the pharmacology question. Think about it. What is this medication doing? It's a dopamine, it block dopamine. So block dopamine. Therefore, we got to unblock dopamine. And then since the muscle is contracting, we got to prevent the muscle from doing excessive contraction. So we give them muscle relaxant to relax it, but we have to give him something to block the calcium that is being released. Key fact, key concept, you have to know. Medication you need to know is dantrolene. Give this patient dantrolene. That will help with the muscle rigidity to block the calcium that is being released by the excessive contraction due to dopamine blockage. So they get dantrolene, and then we give them more dopamine. What medication will you give to give replacement of dopamine? That medication is bromocriptine. It's a dopamine agonist. So this one and that one need to be given to these patients. This to relax them, this to block the calcium, this to replace what? The dopamine that is being blocked by Thorazine. If you don't see this, I can give you another medication, risperidone. This is a first generation antipsychotic. This is a second generation antipsychotic. Most of the first generation antipsychotic block dopamine. So they have a high risk of creating this situation. But what do you have? You have the classic symptoms of something I call fever. Fever. That's the acronym. So the F, okay, is fever. E is encephalopathy. That means change in mental status, right? So that is and the V is the change in vitals. Your vitals changes. That's your tachycardia, hypertension, all those things. You got to see that, right? So those are the things you see in terms of the fever. Then the E, what do you guys think? What do you think is the E is? The E is the elevated creatinine kinase, so the CPK. This one, because of the rhabdo, and the R is the muscle rigidity. This is fever, and fever, the diagnosis of fever is neuroleptic malignant syndrome. So that's what the patient has. NMS. If you don't have alcohol withdrawal, you just have NMS. The board will make it difficult like that. This is the way it was presented based on the way the person described it. Somebody went into alcohol, me in church, and with his friends, they had some alcohol, but when he came in, he's showing signs and symptoms of that. You have to go through the case and look for all these things and be able to check the box. They're not going to make it straightforward. They will give you some idea, but you have to, don't be distracted because you went out and you drink. Look at the rest of the case and see what you have. I provided you all the things and things you need to answer the question. And this is the way you should be, have it open-minded, know the concept, but if they try to make it difficult, don't worry. Just keyword, the beginning, I told you, buzzwords, the buzzwords. And I keep on saying it. If you listen, you'll be good. The buzzwords is the key for case study. There's no way you can do a case study and you don't understand the key signs and symptoms for each disease process. When you study, I want you to write them down. If you're talking about myocardial infarction, there's key signs and symptoms you're supposed to know. If it's pericarditis, if you don't tell me there's a diffuse ST elevation in all EKG leads, it cannot be pericarditis because everybody will have chest pain. Their pain, they lean forward and the pain get better. Those are the buzzwords. For this one is fever. And the key word is muscle rigidity, autonomic dysfunction, fever over 103, and the rest of them is history. The first, those who took the exams, they think it was hard. It wasn't hard. It was presented in the way you don't see it, but this is the way you have to think. Keep on thinking, and then let it be. Start from the case they're giving you and just see, like, no, this is not alcohol. I've given you everything to tell you it's not alcohol withdrawal. There is no hallucination. If you're withdrawing, you see Jesus on the wall. That's what the patient, somebody is on the wall. They will tell you somebody is on the wall, it's coming to kill them. But they will have signs and symptoms. They will be sweaty, they will be tachycardic, they will be diaphoretic. But what? Their reflexes is not going to be normal. They're not going to have normal clearness. They will be hallucinating. Their creatinine kinase is not going to be 10,000. That's your clue there. A, I don't think when you are withdrawing with alcohol, your creatinine kinase is 10,000. So pay attention and you'll be fine. But like I said, pay attention to the buzzwords and you'll be okay. Take care of yourself. This is our Dr. NCLEX out. A simple case study for the next generation NCLEX. I do this to help you guys think, like when you're going through the case, I don't know, there's so many videos out there that will teach you different way, but I want you to like find something that is like more palatable to you, that is compatible to the way you study. I usually like to present it this way because it's more better to understand it, the concept, in the concept way of the case, so that you understand that, oh, this is the case. And because that's the way they're going to present it, a bunch of stuff. And it's a story they're telling you. They're telling you story. So when you're studying, practice that storytelling strategy, and you said, oh, okay, if you go to your world, the same thing. They present the thing like a story. Somebody went this and do that and do that and do that and do that. And then you sit down and said, I need to do differential diagnosis. I need to do review of system. I need to look at each word in the case. I need to parcel them up and say, hey, this is not consistent with that. That is why I give you no, no, no. Every time you see no, just don't let it go. No means there is one diagnosis being taken out of the picture. So when you see them, don't rush. Just go through the case and figure out what are the key ways you need to use and put it together and say, hey, I think this is neuroleptic malignant syndrome. I think this is alcohol withdrawal. I think this is serotonin syndrome. And then your management is easy. Of course, you got to bring your content, know what you need to do, how to manage this particular problem. Take care of yourself and good night. All the best of luck. Bye.